If you are over 60, please hear me on this. Your body often whispers before it shouts. A little dizziness. Swollen feet at the end of the day. A strange pain in the legs when you walk. Trouble thinking clearly. Changes in the bathroom that seem easy to brush off. These may look like small parts of getting older, but sometimes they are warning signs of a bigger problem. And the earlier you notice them, the more choices you may have. I'm Dr. Amelia Watson, and today I want to walk with you through 5 warning signs many older adults ignore. Not to frighten you, but to help you protect your health, your confidence, and your independence. Because what many people miss after 60 is this: the body does not always send loud alarms first. Sometimes the most serious problems begin with quiet changes that show up in everyday life. One of the most common warning signs is feeling dizzy, lightheaded, or unsteady, especially when you stand up. Many people say, "I just got up too fast," and sometimes that is true. But if it keeps happening, or if you feel like you might fall, that deserves attention. It can be linked to dehydration, blood pressure changes, inner ear trouble, blood sugar problems, heart rhythm issues, or even side effects from medicine. Here's the part many people miss. A balance problem is not just about comfort. It can lead to falls, and falls can change life very quickly after 60. Another warning sign is swelling in the feet, ankles, or lower legs, especially if your shoes feel tighter, your socks leave deep marks, or your weight seems to jump up fast. Many people blame salt, heat, or just getting older. But swelling can also be a sign that the body is holding on to extra fluid. That sometimes happens when the heart or kidneys are under stress. If swelling comes with shortness of breath, chest pressure, or trouble lying flat at night, do not wait around hoping it will pass. That needs prompt medical attention. If this is already helping you, let me know you're here. Leave a comment with your age, or tell me which warning sign you or a loved one has noticed. And if you want more simple senior health tips about blood pressure, memory, walking, sleep, and safe aging, subscribe and stay with me. My goal is to help you feel informed, calm, and stronger one step at a time. Now let's keep going, because the next sign is one that many good people ignore for months. It is pain, heaviness, cramping, or burning in the legs when walking that gets better when you stop and rest. A lot of older adults think this is just aging, arthritis, or being out of shape. But sometimes it can point to poor circulation in the legs. In simple words, the blood may not be moving as well as it should. You might also notice one foot feels colder than the other, or a sole on the foot heals very slowly. This matters because poor circulation in the legs can also be a clue that blood vessels in other parts of the body need attention too. It is not something to ignore and push through. Another warning sign is a change in memory or thinking that is more than the usual little slip. We all forget names now and then. We all walk into a room and forget why we went there. That can happen at any age. What worries me more is when memory problems start to disturb daily life. Asking the same question again and again. Getting lost in a place that should feel familiar. Trouble paying bills that used to be easy. Losing track of time often. Struggling to follow a normal conversation. That does not always mean dementia. Sometimes confusion can come from dehydration, infection, low oxygen, low blood sugar, poor sleep, or a medication problem. But that is exactly why it should be checked. Sudden confusion is especially important. If someone suddenly becomes confused, has trouble speaking, looks weak on one side, or seems very different all at once, that can be an emergency. There is also a warning sign many people feel embarrassed to talk about, and that is a change in urine or bathroom habits. Maybe you are getting up to urinate much more often at night. Maybe the urine looks foamy again and again. Maybe you see blood. Maybe your eyes look puffy in the morning, and you feel worn out even after sleeping. People often blame age, poor sleep, or drinking too much tea late in the day. But changes like these can sometimes be clues about kidney health, blood sugar, or fluid balance. The body has a way of showing strain in small daily patterns before lab work ever becomes part of the story. Now here is one especially practical insight I really want you to remember. Sometimes the bigger problem is not just one symptom. It is the pattern. A little dizziness, plus a new pill. Swollen ankles, plus shortness of breath. Leg pain when walking, plus slow healing. Memory changes, plus missed medicines. Bathroom changes, plus deep fatigue. When you start to see the pattern, you stop blaming yourself and you start asking better questions. This is why I tell older adults and caregivers to do a simple health check at home. Not a complicated chart. Just a quiet minute of noticing. Are your shoes tighter than last week? Are you more short of breath walking to the mailbox? Do you feel dizzy when you stand? Are you asking the same question over and over? Are you waking up all night to use the bathroom? Is your walking pain changing? Small notes like these can be very helpful when you talk with your doctor. And there is one more thing many people miss. Medicines can play a bigger role than they realize. If a warning sign started after a new prescription, a dose change, or adding even one more pill, bring that up. Dizziness, confusion, swelling, bathroom changes, and balance problems can sometimes be made worse by medication side effects or by medicines interacting with each other. Please do not stop a prescription suddenly on your own. But do ask for a medication review. That is a smart question, not a rude one. Let's make this simple. What should you do if one of these warning signs sounds familiar? First, do not panic. Many symptoms have more than one possible cause. Second, do not brush it off for months. Write down what you notice, when it happens, and what makes it better or worse. Third, talk with a qualified healthcare professional, especially if you have heart disease, diabetes, kidney problems, high blood pressure, or if you take several medicines. And if you have chest pain, severe shortness of breath, fainting, sudden confusion, trouble speaking, sudden weakness, or signs of a stroke, get emergency help right away. The good news is that paying attention is powerful. You do not need to become afraid of every ache or every tired day. You just need to become a better observer of your own body. That is how many people stay independent longer. They notice changes early. They ask questions early. They get help before a small issue becomes a much bigger one. If you remember nothing else from today, remember this. After 60, warning signs are easy to dismiss because they often arrive quietly. But quiet does not mean harmless. A steady body, a clear mind, healthy circulation, and good kidney and heart health all matter deeply if you want to keep living life on your terms. Thank you for spending this time with me. If someone you love is over 60, please share this with them. And before you go, tell me in the comments which sign surprised you most, or what topic you want me to cover next. I'm here to help you stay informed, stay steady, and age with confidence.